Hello, hello, and welcome to the 100 Jobs Project. I'm your host, Katie Monson-Gant, and if you are new to the show, a quick little TLDR, the 100 Jobs Project is a place where I'm interviewing 100 people about what they do for work, how they got into their fields, how it fits into their everyday life. So if you're curious about what your friends, your neighbors, the people at the gym are doing, this is your place to find out. We're sharing 100 stories here to help you find yours. So I'm so excited about our conversation for today. Welcome to the show, my dear friend Dana.
Hi, thank you for having me.
Yeah, thank you for coming on the show. So Dana, I'll let you introduce yourself a little bit, but just for a quick background, Dana is a physician's assistant working in a dermatology office in Arizona. We met, 3-4 years ago when she was in school out here in Virginia near the DC area where I'm at. And, we've been in touch since. I think Dana has a really cool job and a great story. So we're going to get into it today.
Well, thanks. I'm really excited to be here and excited to chat with you, Katie. Like you mentioned, I am a dermatology physician assistant. I was trained at Shenandoah University, which is in that Northern Virginia, DC area. It's how we met. So I got my master's in physician assistant studies. And then right after that, I got my doctor of medical sciences, which is the terminal degree in the PA field. So after graduation, I started working. I moved out back to Arizona, which is where I'm from, and that's where I practice today.
I don't know too much about your program. We'll get into it, but are you practicing as a physician's assistant or are you practicing as what you said?
So I am practicing as a physician assistant.
Okay.
Recent legislature has passed where now we're starting to use the term physician associate. That's kind of on a state by state basis. I do have my doctorate, and that is, I'm not a medical doctor. It's a doctor of medical sciences, which is a little bit different. I would be a doctor if I, for example, taught at a university level and was a professor, but in a clinical setting and in a medical practice, I am a physician associate. I don't call myself doctor.
Okay, thank you for making that distinction. There are so many different titles and certifications and degrees and programs that people can do. It gets a little confusing for me. I believe it gets a little confusing for other people too, so it's always helpful to know and understand kind of what those programs are like. And we'll chat all about your whole story and, how you got there and how you got into those programs. But I do want to ask you a couple of little skincare questions up front.
Is that good. Okay? This is the fun part.
Okay, fabulous. So, you're a skincare girly. Are you showing up to work with like fresh skin or with a full face of makeup?
I do a mixture of both. It kind of depends on how my skin is feeling that day. Sometimes I will go in with just fresh, clean skin. Most of the time I have a little tinted moisturizer on.
Dana has like the most gorgeous glassy skin I have ever seen. It's just like, I feel like it has always just been like clear porcelain. So we need your tips. We need your tinted moisturizer or tinted sunscreen.
Tinted moisturizer.
Okay.
Sunscreen should be separate, but I'm happy to share any and all of my secrets. Good skincare is something you build over time. It is not something I was just gifted naturally, is clear skin. So I'm really passionate about helping other people clear their own skin.
Okay, Dana, you're breaking my heart a little bit because I have been using a tinted sunscreen. I think that's what I think I heard you say, tinted moisturizer, but because I have often used a tinted sunscreen, like that's what my brain went to. Yes, please clarify.
Really quick. So I'm now parsing hairs here, but a tinted moisturizer is great. Foundation with sunscreen in it does not typically have enough sun protection to be your only source of sunscreen.
Okay, so that's fair.
Yeah, so there is a difference. So tinted moisturizer is perfect. If you're wearing a traditional sunscreen that has SPF, you need additional SPF underneath that.
Good to know. No, that is a very good way to parse hairs. Thank you for educating all of us here a little bit. So we'll go with the sunscreen moisturizer. This was my next question. I think you answered it. I was going to say sunscreen or moisturizer. You can only pick one.
I don't want to live in a world where I have to choose, but if I had to, it's sunscreen for sure.
Mm-hmm. And at least you would be putting something on your face. So I don't know, maybe you get a little bit of residual moisture.
If you're more moisturizing sunscreen, for sure.
And it would still be like a layer of protection, like a nice little barrier there.
Mm-hmm.
I like it. Okay, you've got $1,000 to spend, but you can only spend it on either skincare or your wardrobe. Which are you picking?
My wardrobe. I firmly believe that you do not have to spend a lot of money to have a skincare routine that does a lot of work for your skin.
Okay, well then we need your skincare routine. Share it with the world. The final thing that we'll chat about is what is in your work bag? What are you bringing to work every day as a physician's assistant working in dermatology?
So my work bag is pretty empty, actually. I leave my work at work. So I don't bring home my iPad or my laptop. My work bag has my favorite lip gloss in it, which is a SAIE, their lip gloss in the Kiss color. It's perfect. I also have some silk scrunchies because at work, my worst nightmare is my hair falling on somebody's warty foot. That is absolutely disgusting. And then third, I always carry my favorite protein bar, which is the G2G protein bar. It's the peanut butter chocolate chip flavor, and it's perfect.
Ooh, I haven't had one of those in a long time, but I now have a hankering, so thank you. Okay, so you got some Say lip gloss. Does it leave some moisture on your lips?
It does. I think
Okay.
it's technically a lip oil.
Oh, okay. Good to know.
So it's not sticky, a little bit of color. It's perfect.
That's one I'll have to check out. And I believe that's like a clean beauty brand too, isn't it?
Probably, but clean beauty is all marketing. There's absolutely zero regulation in the clean beauty or clean skincare or even medical grade skincare market. Those are terms that people just put on products.
Okay, interesting. I'm learning so much already, and I feel like as a marketing girly, I should probably know this, but I've never worked in the beauty space. So clean beauty isn't clean beauty. You don't have to spend a lot of money on skincare, and sunscreen is where it's at. Honestly, we could stop the podcast right here.
You about summed up my deepest held beliefs in life right there.
I love it. Well, let's get into how you got to those beliefs. How did you get to this dream of being a physician's assistant? Was this something that you wanted from the time you were young, or did this kind of grow and evolve with you throughout your life?
When I was 14 years old, I had acne, as teenagers do. And so my mom took me to see a dermatology PA, and she asked me what I wanted to be when I grew up, because I think she was just trying to build some rapport with a teenager. And so I told her I wanted to go into medicine. I probably said I wanted to be a doctor. And she said, well, have you considered being a PA? And I had never heard of that before. And so I kind of took that and ran with it. I went home, I started researching, what is a PA? How much money do they make? What kind of education do they get? And how do they get into graduate school? What can they do? All of these questions. And it really lit a fire in me. And I think part of that is because I was a very, impressionable young teenager. And I also saw my dermatology PA as somebody I wanted to be like. She was so personable, and she made me feel like I was an important person when I was sitting in her, in her patient room. I thought, wow, like she really cares about me. She cares if my skin gets better. I want to be like that. I want to have this impact on others. And so that's really where the dream started. And I held that close for a long time. And in college, I kind of deviated a little bit. I pursued being a clinical psychologist for a couple years. I majored in psychology and very quickly realized I don't like doing research. I'm so glad other people like to do it, but I am just not that person. And so after that, I kind of transitioned back into looking into, going to PA school and what would that take and that whole process. So a long, windy road, but the moral of the story is I learned about this when I was 14, and that's really where it all started for me.
14 is still pretty young to find something that you're really interested in. And it's neat that you were able to find that and then explore a few more options and come back to that. You hear so much about the things that you were really interested in when you were younger, or even in your childhood, being things that might be, good fits for you in career later in your life. And it sounds like you are a testament to that. I think it's also a testament to the impact that people can have when they really truly care about you, when they listen to you, when they make you feel heard, when they make you feel important, when they make you feel like they care about you. I mean, what does that do aside from inspire you to be just like them?
I mean, it changed my life. So yeah, I'm a good testament to
that's amazing.
Good role models.
So you were 14 when you were kind of interested in becoming a physician's assistant. When you started looking into dermatology, you started working on your own skin. Or your first couple of jobs, were those kind of adjacent to those interests? Or did you have an early job at like an ice cream shop or something totally different?
A little bit of both. So my very first job was as a piano teacher. I started taking lessons myself when I was 4 years old, and word spread around my neighborhood that there was an 8th grader who would teach piano lessons that were really affordable. And, I was a really good kid. So I think parents looked at me and said, we would like our younger, impressionable children to have this kind of role model. And so I think I taught 8 students throughout high school. And that was my first job and experience making money and, setting my rates and all that type of thing. And then in college, I worked as a receptionist. I actually did have a stint as an ice cream scooper at one point in time.
No way.
Yeah, I did.
Love it.
My first real medical adjacent job was as a medical assistant in New York City. I worked at a dermatology practice. And that's really when things started to kind of click for me. And I said, okay, I want to come back to this medical space. I really like dermatology. And now I'm getting this exposure and this experience that is going to make it possible. Because to get into PA school, you have to have patient care hours. It's one of the biggest requirements. And so that particular job as a medical assistant was really formative for me.
Yeah, that's a really interesting way to go about it. I didn't realize that you needed medical hours of some sort in order to go into PA school. I think that's a little different than a lot of medical schools, isn't it?
So patient care hours I think they're required by medical schools as well, or at least very highly encouraged. I don't know the specifics because I never applied to medical school. But on average, at least the year I applied, a PA applicant had over 3,000 to 4,000 hours of patient care experience.
Wow.
I applied with 400 because, as I said, I was kind of late to coming back around to this idea. So my application was a little unconventional.
Okay, no, that's really interesting and good to know. I am learning a lot from you here about what this process looks like if, I wanted to become a physician's assistant later in life. I'm getting my MBA right now, and I think that 2 degrees might be enough for me. So you said New York City. Was that where you did your undergrad degree? Did you move there after?
I moved there after. So I did my undergrad at Brigham Young University. I studied psychology because, as I previously mentioned, I thought I was going to be a psychologist. We moved there after school. My husband, he got a job there. And so we moved out there for his work. And so I looked for jobs once we were there, and I was experimenting in the medical field. So I thought, I'm just going to apply to this job as a medical assistant. Usually medical assistants have certifications. They actually go to programs to become trained, and I didn't have any of that. I sent in my application with a very heartfelt cover letter that, only a young adult could write that said, look, I'm passionate about this. I really want this experience. I will be the best employee you have ever had, but I need you to train me. And so that's how I got that job.
There's so many times I feel like in the corporate world, which has been a lot of my experience, where a cover letter just feels like one of the boxes to check in submitting your application, and it doesn't do a whole lot unless maybe your resume gets noticed or pulled out of the stack. Then maybe someone will go back and take a look at your cover letter. But when you're working in a clinical setting like that, I can see how a cover letter can be really impactful. Was this the bougie Upper East Side dermatology clinic that you were working at? Okay, can you tell us a little bit about what that was like?
Sure. So I worked on the Upper East Side in New York City, and, it's just a different world. Our clientele were some of the richest people in the world. And so it was a very fun, very fascinating place to work. I think it's just a different style of medicine in the sense that it wasn't, a lot of times when you see patients, depending on the clinic you're at, patients come from all different types of demographics, and they have different types of insurance, and what their insurance will and will not cover really impacts the type of care you can provide and the services and prescriptions they get. At this place, we didn't accept insurance. It was closer to a concierge style medical practice, and so we didn't have those constraints. So in a lot of ways, it was a really fun way to see medicine practiced because you could do exactly what you wanted to do for that patient. You didn't have to jump through these hoops of how can we get these procedures or these medications approved. And so that part was really interesting. There were no barriers to accessing care that I've seen at other practices.
Yeah, I could see that being a really interesting way to cut your teeth on things because you're really, like, the sky is the limit, it sounds like, in what you were able to do, not being held back by insurance or this or that. But at the same time, I think that working with insurance can probably be part of the process that you have to learn. So you get some pros and cons there. Was this mostly cosmetic procedures that people were doing, or did you see a lot of medical stuff as well?
I would say 60% medical, 40% cosmetic. And by medical, I mean full skin exams. We were doing, excisions for skin cancers that had been identified. We had a Mohs surgeon in the office who that's a specialized type of surgery that's done for specific skin cancers and on specific locations of the body. And so we had a lot of that. But often patients will come in and they're getting a full skin exam and then they say, oh, I also really want my Botox touched up, or I'd like some filler, or I'd like this laser. Do you have time? And the answer is always yes, we have time.
Wow, fascinating. Did you have to sign NDAs at all at that practice?
I did not.
Okay. I mean, I guess you're probably under HIPAA and stuff anyway, so it's not like you're going to say, hey, we just saw this celebrity. Did you see any celebrities in that practice?
Did I?
Yeah.
I did.
Wow. Mm-hmm. And you can't tell us anything about it?
I'm bound by HIPAA.
Dana treated the stars.
I was in the back of the room putting Band-Aids on people. But yes, I was there, and it was really fun.
Yeah. What did you learn at that practice? Anything, both in relation to, is there anything that we should be looking for in our skincare as we're getting older, but also, what did you learn personally about what was next for you?
The biggest thing I learned is when you're looking at somebody's skin, I can tell based on looking at your skin how much sun exposure you've had. I can tell if you've been in tanning beds. I can tell if you grew up in Arizona or if you grew up somewhere else. Your skin tells a story, and it's a cumulative story of your lifetime. And so the most important things I learned for, aging gracefully, helping prevent skin cancer is wear your sunscreen every day, get a retinol or a retinoid on board in your skincare routine, and just be religious about those two things. You can avoid a lot of problems that way. And you can also be really happy with how your skin is aging when you do those two things. As far as personally, for things that I learned moving forward, I really learned how I wanted to practice medicine. In concierge, style medicine, the patient is everything. You do what you can to make sure that you are fixing the problem. You're diagnosing it correctly. There's no barrier to getting them the treatment they need. And it's all about the relationship with them. And I wanted to take that with me to my practice. Even though I take insurance, my clientele is very, very different. That relationship is still really important to me.
What an amazing thing to be able to learn at a relatively young age. I mean, you were in your early 20s living in New York City, and to have that experience impact how you wanted to practice medicine for the rest of your life is really cool. Are you still in touch with any mentors or doctors or people from that role, or has that kind of fallen to the wayside as you've shifted and gone to PA school and advanced your career?
A little bit of both. I send my old boss a Christmas card every year, and we'll occasionally exchange an email like, how are you doing? I'm doing great. They've written letters of reference for me, which is amazing and so appreciated, because it really does matter, the people who support you. A large reason that I got into PA school actually was the letter of reference I got from my boss. Multiple times during interviews, I had people say, wow, your boss really loves you. Like, what's going on here? So it's important, I think, to maintain those relationships. And of course, it's not as close as it used to be when I was living there, but I try to still keep a friendly line extended.
You said that you had about 400 hours when a lot of people applying had 3,000 or 4,000 hours. Mm-hmm. So you're never too late. You can have 400 hours, and if you are doing really, really well, really putting it in, you're showing people that you have the heart for this. There are other ways that the world is going to come together and help push you in the direction of what you're supposed to be doing for your future. Christmas cards are such a great way to stay in touch with people. And I love seeing them from old friends, from people like you who have moved away, from old bosses, from old coworkers. It's so fun to just get a little snapshot into the lives of these people who have meant so much to you at different points in your life and who you've been really close with and seen every single day. So the Christmas cards, big fan. We just did some family pictures for our Christmas cards too. So
I'll put it on my fridge. Your Christmas card last year was beautiful.
Thank you. We did a little apple picking shoot.
Loved it.
Your Christmas card last year was lovely too. We could compliment each other all day, but I want to hear a little bit about PA school too. So we heard a little bit about your application. Can you tell us what the whole process was like from application to graduation?
So the application for process to get into PA school is really quite intense. I think about 31% of applicants actually get into PA school, which is They're not great odds. So the application opens at the end of April. It's actually standardized for most PA schools across the country. They use a platform online and they all drop on pretty much the same day with a couple of exceptions. And so you have to send in multiple letters of recommendation from current employers, former employers. You have to demonstrate that you have extensive patient care experience, that you know what you're getting into. You have to submit volunteer hours, leadership experience. Of course, the most important piece is typically your GPA, even more so your science GPA. They'll pull out your science curriculum, the prerequisites required for that school, and they will weight that separately. And then, of course, if you are accepted, if you make it through that run of the application review process, then it's the interviews. And sometimes there's multiple interviews. They have different interview styles where it's one-on-one between you and a faculty member. Sometimes they're group interviews where they ask you questions in a group of 10 other applicants to see how you problem solve or how you think through issues. That part is also pretty intensive. It requires you to be able to, one, pay the application fee, pay to travel to these schools and do these interviews. And then at the end of it, if you're lucky and if you're prepared and you work really hard, then you get into PA school. And so I ended up getting into several, which was really amazing. It gave me the option to kind of pick and choose what I really wanted in a school. And so I ended up choosing Shenandoah University, and it was the perfect fit for me. I really loved it. I had a fabulous experience there.
And Shenandoah University is in Virginia.
It is. So the main campus is in Winchester, Virginia, which is right in that corner by West Virginia.
Okay.
You could throw a rock and you're in West Virginia.
Yeah. And now you weren't in Winchester or Leesburg even for the full course of PA school. You were moving around at different practices too, doing different rotations.
So PA school is anywhere from 24 to 36 months. The average PA school, I think, is a 27-month program. Mine was 30. And so for the first year and a half, I was in a classroom exclusively. And you pick a module like cardiology and you go through everything there is about cardiology, all the diagnoses, the diagnostic testing, how to order them, how to interpret these tests, the medications and pharmacology that is related to cardiology. We focus on that, subject at a time: cardiology, pulmonology, dermatology. And then after that classroom period, which usually lasts a year to a year and a half, you do rotations. And rotations are actually set by the board. Every PA student is required to do, for example, a rotation in emergency medicine and family medicine and OBGYN. And the purpose is really to make you as well-rounded as possible and to give you the experience you need to be able to go into practice. Because after graduation, we immediately go to practice. And so it was great, to answer your question. It's really fascinating to go new places every 6 weeks. I was in a different hospital doing a different specialty, new coworkers, a new preceptor. It's intimidating. You always feel, to some degree that you have no idea what's going on. But by the end of it, you've grown a lot and you've learned a lot. And it's a really good way, I think, to get exposure to different fields and also to practice your skills and your knowledge base and to practice being a provider while you still have a high level of supervision.
That's such an important distinction too, because we have talked a lot about dermatology because that is what your interest has been. That is what you are currently doing now. But you are in PA school doing all of the different things. Did you ever think in the middle of a rotation, like, oh, maybe I have been called to do something different?
That happened to me twice. So I went into PA school pretty set on dermatology, just based on my experience. But on rotation, I fell in love with pediatrics, which I think is partly because my preceptor was so fabulous. She was really a very supportive mentor to me and really saw something in me and nurtured that. And it came more naturally to me. I like the medicine of pediatrics. I like patients who are younger. I think they're so interesting and the medicine is different. So I loved that. And then I also really loved fertility medicine. I did a rotation there and I loved it.
You also went to Guam, if I'm not mistaken, as part of PA school. Can you tell us a little bit about what you were there for and what that was like?
Yes, that was really fun. So in Guam, which is a territory of the United States, there is an OBGYN who accepts students from my school for their OBGYN rotation. And in Guam, PA students, for whatever reason, were allowed to help and assist in the delivery of babies. You can assist in C-sections, you can assist vaginal births. And in the United States, contiguous United States, that's not very common, I don't think, to have a PA in the delivery room. Of course, there are exceptions here and there, but to my knowledge, it's not as common. And so I went over there with a friend because we really wanted that experience. It seemed very unique, but also, just a good way to kind of round out some skills that we wouldn't get other ways. And so we went out to Guam and, we had to apply for it. Not everybody gets to go, of course, because there's limited spots of students that can come. But I was there for 6 weeks and it was an amazing experience. I loved it. I think about it often.
Yeah, well, and especially I think you ended there with a tsunami, if I'm not mistaken.
A super typhoon, close.
Okay, yeah. Yes. It started with a T, a lot of waves, a lot of wind.
Yes.
That is just so wild. I mean, I can't imagine that 14-year-old Dana ever thought, yeah, one day I'm going to be in PA school in Guam delivering babies in a super typhoon.
Even 30-year-old Dana has a hard time imagining that happened. That was just a crazy experience. We didn't know it was coming. Or, I didn't because I wasn't checking the weather. I wasn't tuned into Guam news. And so I remember being at clinic one day and one of the nurses said, hey, have you heard about the storm that's coming? And we go, what storm? It turns out that, in less than 48 hours, this super typhoon, category 4 super typhoon was going to hit. And so you barricade yourself into your home. All the homes there have these big metal shutters for this very purpose.
Wow.
To protect against storms. And so we got barricaded in our home and we lost power and water and we were trapped in there, I think for 4 days. And, every window and door had flooded with water. We were living off of granola bars and beef jerky. It was absolutely insane.
4 days is a long time to be stuck somewhere. Were there ever any moments where you were feeling a little bit unsure or unsafe about what was coming next?
Oh, absolutely. I think right in the height of the storm, right when we lost power and there's water actively flooding the home, we're watching it come in through the windows and we're sitting huddled together in the middle of this living room. We're playing Uno by flashlight and our Uno cards are gradually swelling with water because it's so humid. That moment was a little scary where we go, okay, we're pretty sure this is going to be okay, but we don't know. There's always this element of we're not sure what's going to happen here. But, it ended up being okay. Somebody came and broke us out of our house a few days later and, we got a clean shower and we were able to move somewhere that did have power. But the island was it was hurt.
First of all, I'm so glad that you guys were all safe and accounted for and everything was good. Second of all, the Uno thing is awesome. That's also really demonstrative of just some of the challenges that can come when you are practicing medicine in not a first world country. Was there anything else that you learned in Guam just about, the differences between the U.S. and medical care outside of the U.S.?
Guam does follow United States standards of care because it is a United States territory. Sure. So, I think the biggest thing is access to care is so limited, depending on where you live. And that's true in the contiguous United States as well. Rural medicine is so different than medicine outside of Washington, D.C. or Arizona or New York City. And so access to care is really limited, I think, by how many providers you have there and specific providers. I was rotating with a really great OBGYN, but he also served most of the island. Most women who are pregnant there see this provider because there's just not a lot to choose from. Yeah. So there's a big push in medicine, I think, to expand access to care. And a lot of people feel called to practice rural medicine for that very reason. And you really kind of decide personally, where am I going to live and how am I going to practice? And are there populations I can serve better in other places or in my community?
I mean, that is obviously not what you're doing now. You have graduated from PA school. You've had all those wonderful rotations. You are back to your calling in the derm setting. Can you walk me through a typical work day for you now?
As we talked about before, Katie, we met when I was living in Virginia. And so I knew I was moving to Arizona. And so I was applying actively to jobs here. And I actually reached out to the PA who had told me to pursue PA school. And I sent her an email with my resume and a cover letter. And my cover letter essentially said, this is who I am. You probably don't remember me, but 15 years ago, you told me to consider PA school. And that's exactly what I did. And I'm now a PA. I'm, living in Arizona, and I want to work with you. And she agreed to interview me, and we just clicked. And I really was so appreciative of the encouragement she gave me when I was younger. And as an adult, I appreciate that she took a chance on me. Most of the time to get into dermatology, you have to have 3 years of experience in internal med or family med or emergency med or urgent care even. And I didn't have that. I think I'd been working a month in my first job when I reached out to her. So that's kind of how I got this job. I work part-time, which I think is important to know. So I typically see my first patient at 7:30 in the morning. And depending on the day, I finish around 1 or like 4. And so I wake up a little before 6, I get ready, I'm out the door before 6:30, and usually try to be in my chair 30 minutes before my first patient arrives. And so I spend that time charting, I review pathology reports. If I've done a biopsy and it comes back and it hits my file, I will see, what did it come back as? Do I need to create more treatment plans for this patient? Do they need to have surgery? Do they need to have medication? Do they need to come back in? And I answer patient questions if somebody's called in with a problem. And then once I start seeing my first patient, I see patients every 15 to 30 minutes until I'm done. I see a lot of teenagers for acne. I do psoriasis, warts, rashes, like you wouldn't believe. The full gamut. And then of course I have a little sprinkle of the cosmetic dermatology side. I do a little Botox if a patient wants like an IPL, which is intense pulse light procedure, or radiofrequency microneedling, and they want me to do it, I also do that.
And do you have a preference between doing some of the cosmetic stuff versus the medical stuff?
I prefer medical dermatology, but I love the variety. Yeah. I do like the opportunity to kind of switch it up, because every time I walk into a patient room, I'm seeing something different. I'm seeing somebody different, and I'm doing something different. Dermatology is very procedural heavy. So, for example, I do biopsies all day long. I'm always doing injections and biopsies and, whatever procedure they need, whereas some medical fields are less procedure heavy. So I like this hands-on aspect of it.
Seems like it's hands-on and also, of course, very patient-centric. Mm-hmm. You're on the side of the medical field where you are interacting with people and you are working with people and you're talking to people, which, what a great way to have variety in your day. Can you tell me briefly, how is your role as a PA different from that of a dermatologist or a nurse or an esthetician?
I think the primary difference between a PA and a doctor, for example, is a doctor goes to medical school, which is 4 years of training. And then they also complete a medical residency afterwards, which is usually anywhere from, I think, 2 to 5 years. And so they are very specialized and they have a lot of training time. A PA, it's much shorter, and I don't have a residency. So there's something called lateral mobility in the PA profession where I can start in pediatrics, for example, which is what I did. And then I moved to dermatology, which is a completely different specialty, but I can do that. If a doctor specializes and then they stay in their field for the duration of their career, typically.
A PA has some flexibility to move from different field to field within the medical field, whereas, a doctor specializes and they're there.
And a nurse is more bedside care. Think of it in a hospital, they're delivering medications, they're placing IVs, that type of thing. And then an esthetician, it's a certificate program and then you're certified to do things like facials, maybe chemical peels. You can also get laser certifications as an esthetician. So you can operate some of the lasers you might find at a dermatology practice or a med spa.
Which, might be a good way if you want to dip your toes into that world, is maybe get that certificate and see if it is something that you want to carry on doing in more of a medical capacity. Great to remember, next time I go to the dermatologist, I'm going to be remembering that they went to medical school and had rotations, doing heart stuff, doing internal medicine stuff, and they chose this. Now, we also kind of skipped over your doctorate program. I know that was a really quick kind of turnaround from when you finished PA school to when you started that. And so in my brain, sometimes I kind of clump those things together. But I would love to hear a little bit more about how you decided to go about that and what that process was like too.
Doctorate level PAs are not very common, and primarily I think that's because it's a new degree for the field and it's not required to be a practicing PA. You can be a master's level educated PA and practice, and that's actually the norm. And so I decided to get my doctorate, one, because my program was offering it. They were actually starting this new doctorate program, and I said, sure, I'll do that. I'm already in the school mode, and I was interested in possibly teaching later on down the road.
It's so tempting to want to break when you finish school, but sometimes it is the right call to just jump right back into the next step. You know, you mentioned too that you are working part-time, you have a family, you have a little one at home. What has that transition been like?
I had a friend tell me once, there is never a good time to have a baby or have a family. And I was really paralyzed by that prospect. I am somebody who loves to have things just work out exactly the way I want them to. And I wanted to be able to give everything to my career and everything to my family. And it was a hard lesson to learn that there's no good time to do it. And there's no good balance as you do it. So I started working already pregnant. I was pregnant when I graduated from PA school. And so my first job I interviewed at, I told them, you know, I'm pregnant. This is what I'm due. I hoped that they would, you know, in good faith, evaluate my application and my interview. And because, you know, people do face discrimination for
They're
pregnancy.
not supposed to, but it happens all the time, really regularly.
That is true, and it's unfortunate. So I was pregnant when I started my first job, and I, you know, a few months into my job, I realized that I started in pediatrics, which I did love, but I wanted to be in derm. And so that's when I started working towards this, applying to this other dermatology job. And so I had my baby and then took my maternity leave. And then when I came back from maternity leave, that's when I started this new job. And so I was very lucky to have a supportive boss who knew I was pregnant, knew I was having a baby, and I told her I wanted to work part-time, and she said, okay. And so I know a lot of people don't have that experience. Medicine is not a very family-friendly field. It's not the norm to find a good part-time job. It's possible. They're there, absolutely. But it does take a little bit of, I think, luck and persistence in the application process.
And also, if you are really dedicated and looking for the right role, I think you'll always be able to find it.
They're out there. They just take some work. And like you said, a lot of it depends on the specialty too. Surgery is a really hard field to have a family. Surgical hours can be unpredictable. They can be really, really long. You know, if somebody comes in and their surgery goes 5 hours long, you're in the OR. You're not stepping out because you have to go pick up your child from daycare. So I think there are some things like that to consider, but also I don't think it should ever be a limiting factor.
You can have both. You'll just have to find different ways of balancing it. You will need someone who can go pick up your kid for you and they are sick and you are in the middle of a 5-hour surgery versus, you know, something that might have a little bit more flexibility. So there's just trade-offs, but they are absolutely compatible. But that was a big deterrent for me, actually, was I said, you know, I know that there's going to be a lot of school ahead of me if I go into this field, but I also know that I want to have a family. How can I balance those two things? Mm-hmm. And I'm very happy with my life and where I am, but every once in a while there's part of me that wonders, you know, what if I had known then what I realize now? It's just a world that you have to get into and talk to a lot of people, I think, before you really understand how you can go about it in a way that will work for you.
I also heard a lot of those tales, and I think I was really influenced by that. And it is true, though. I mean, if you go into medicine, be it nursing, PA school, medical school, it's hard to balance a career, you know, in medicine and a family. But my husband's an example or an accountant, for example, and it's hard for him too. And I think we need to stop believing these stories that, you know, you can't have it all. Even though you can't, I don't believe you can, but you can have it most of the time. I think you can have about 80% balance going on in your life, and you can make it work if you want to.
I absolutely agree. And I also think that there are different times and seasons where different things are going to work. And just because one season might be a little busier or one season might be a little more dedicated to career, one season might be a little more dedicated to family, that shouldn't deter you from pursuing what you want to pursue. I would love to know how you really feel like you find balance in your life and how you unwind when you're not in the office.
I would not describe my life as perfectly balanced. I think it's maybe 75% balanced, maybe 80% balanced on a really good day. And, it's all about shifting priorities. There are some things that always take priority, like my daughter and, my relationship with my husband. And of course, I need to do well at my job. Those are kind of the big priorities. When I'm at work, I'm at work. And when I'm home, I'm with my child. I don't chart at home. I don't work from my house. Unless it's absolutely necessary. And, sometimes we're getting takeout a lot during the week. If, I'm really busy and my husband is really busy, or, our house is a mess, most of the time. And, we just kind of pick up the pieces where we can. Balance is a tricky thing. I don't believe I could ever have it perfectly balanced, but it's balanced enough for me.
Something is always out of balance. So I agree with you. I don't know that there's ever like a perfect equilibrium. And if there is, something is going to happen really quick to ruin that and throw your whole world up in the air. I love that boundary though of not charting at home, leaving work at work. I know that's not possible for everyone in every field, but I love that you're able to do that.
Me too.
Yeah. Any hobbies or things that you're able to dedicate time to now? I know it's so busy with the little one. Is your little one your hobby?
No, she's not actually. Good. She is. I love her. She's the center of my world. She's not my whole world though. And I think that was a really conscious choice I make every day to say, okay, what do I actually want to be doing here? Mm-hmm. I spend a lot of time at the zoo. I also spend a lot of time reading. We love having friends over. I think we have people over to our house at least once or twice a week for dinner or, to hang out and watch a show. We put our babies down. We put our baby down at our friends' houses, or our friends will come over and put their babies down to sleep here. And then we hang out at night after they're sleeping, upstairs. And so I think surrounding myself with a good village is really how I unwind and, have fun. I think there's always time to indulge in your hobbies or in the things that make you happy.
No, I love it. Travel, hosting, reading. Great friends, movie nights. Put your baby to sleep at someone else's house. I love it. Pack and play is one of the most important investments you can make with a new kid.
100%.
Got to talk a little bit about salary potential as a PA.
Yes.
And my go-to for salary information now is ChatGPT. Chat told me that the average salary opportunities for a PA working in the U.S. ranges anywhere from like $100,000 to $200,000. Is that a range that sounds pretty reasonable given your experience?
Yes. It does. I think a huge, you can actually dive into reports of which specialty makes what on average. I think surgical specialties and dermatology, for example, they're on the higher end of that spectrum. I think your numbers are right. I'm on the lower end of that because I work part-time.
Sure.
The dermatology pay structure, at least for a PA, is a little bit different than I think other specialties. So, for example, I have a base salary, and then I also make a percentage based on how much I bring to the practice over a certain amount. So, for example, if I bring in more, and I'm making these numbers up. So,
sure,
if I bring in more than 20 grand to the practice in a month, anything beyond that, I will make a percentage of that back as an added almost bonus, I guess you could say. And, it all depends on your contract. Sometimes it's 25% of what you bring in over that number, or 30% or more. And so that's important in dermatology because, yes, we bill a lot of things to insurance. And so a lot of that is pretty standard. You know what you're going to bring in.
Yep.
We also bill a lot of things, as self-pay. Insurance doesn't cover things like Botox. It doesn't cover lasers. It doesn't cover a lot of these cosmetic procedures, and dermatology sees a lot of it. And so for a dermatology PA, the potential is there to do quite well.
So you have base salary and then additional for people that you're seeing.
Correct. So, because we bill out and we know how much we're bringing in every month.
Sure.
Per provider. And so if I bring in more than a certain amount, I have the potential to earn, significantly more.
No, that is really helpful to know just the structure of pay and what things are like in 2025 in this world. So thank you for sharing that with me. Thank you for sharing so much of your life and what you do. I've said that we're getting close to the end of questions, but I think this is a good question to end on. If there's anyone out there who is listening to this and interested in pursuing a path like this, what advice would you give to them?
My first advice would be don't count yourself out. until you've actually been rejected. And I say that because I was very intimidated by the process of application and taking these classes. And for a while, actually, I thought, I'm not good enough to do that. I don't have the patient care hours. I don't have, X, Y, Z. And so I rejected myself from PA school before I'd even sent in an application. And so that's my first piece of advice is you don't know what you're capable of until you actually try. And so if you have a dream or something you're interested in, pursue it and go hard for it and see what happens. The worst thing you'll get is somebody saying no. But more often than not, I think you'll get a yes if you're really, being smart about the way you pursue it. And my second piece of advice would be to be as well-rounded as possible. Your application and being a PA, it requires so much. And so, build on leadership experience, build on volunteer hours, build on your patient care hours, work on your GPA. All of that matters. And then all of that kind of helps you bring these skills into being a PA.
That first piece of advice is just really, really good for everyone. So often it is us that counts ourselves out. We are the ones who reject ourselves before we've let anyone else do it. And that's a way to feel safe. It's a way to, protect yourself from that sting of rejection. But like you said, that sting of rejection doesn't often come. And when it does, it doesn't always feel as bad as you would expect it to. Keep trying, don't give up, and don't count yourself out. Well, thank you so much for your wisdom, Dana. I've so appreciated chatting with you and learning with you today. I hope that you find success wherever that takes you in your life. And we will see everyone next time on the podcast. We are out weekly on Wednesdays. You can find us at the100jobsproject.com or on Instagram at the100jobsproject. So thank you, and we'll see you next time.